Welcome to the Explainer. We're all taught to think of heart-related chest pain as a simple plumbing problem, right? Like a blockage in a major pipe. But what happens when the pain is real, debilitating, even, and the pipes are totally clear? Today, we're diving into the heart's hidden pains. So picture this. You go to the doctor with all the classic symptoms of angina, that awful, crushing feeling in your chest. They run all the tests, they do an angiogram to look inside your arteries, and they find absolutely nothing. The big coronary arteries, the main fuel lines for your heart, are wide open. So the question is, where on earth is that pain coming from? To really get our heads around this puzzle, let's look at a clinical case that cardiologists are seeing more and more. It's a real paradox. Okay, check this out. We've got a 50-year-old guy, he smokes, he has high cholesterol, he's a textbook risk case. He shows up with what doctors call typical angina. Everything is pointing to a classic heart blockage. But, and this is the key, the angiogram comes back showing no significant blockages. The main suspect has a perfect alibi. So if the main arteries are in the clear, we've got to look deeper. The answer isn't in the highways of the heart. It's somewhere else, hidden in the heart's much more delicate, intricate network. Well, this condition actually has a name, INOCA. It stands for ischemia with non-obstructive coronary arteries. And what it means is, yes, your pain is absolutely real. It's caused by ischemia, a genuine lack of blood flow to the heart muscle. But it forces doctors to look beyond the usual suspects. So there are really two main things going on here. The first is something called microvascular dysfunction. Think of it like this. The big pipes are fine, but the tiny little pipes deep inside the heart muscle itself just aren't working right. They don't open up like they should. The second cause is vasospasm. This is when the artery wall itself suddenly clenches up like a cramp, choking off blood flow. And here's where it gets really, really frustrating for patients. Because the problem is different, the treatment has to be different too. The standard playbook for angina just doesn't work. And here's why. Standard treatments, like certain beta blockers or statins, are designed to deal with plaque buildup in those major arteries. But with INOCA, that's not the issue. The real target is either the tiny microvessels or the twitchy artery walls. So using those standard drugs is kind of like using a sledgehammer when what you really need is a pair of tweezers. It's just the wrong tool for the job. In fact, it can be even worse than just ineffective. This is a huge point from clinical discussions. For some patients, the standard treatment can be downright harmful. If you've got that vasospastic type of INOCA, beta blockers are actually a no-go because they can trigger the very spasms you're trying to stop. Okay, so this brings us to a much smarter, more targeted way of thinking. When those first-line drugs fail, or they're just not the right fit, clinicians need another tool in their belt. One that actually gets to the root cause of INOCA. And that tool is a medication called Ranolazine. This one is a real game changer because it works in a completely different way from a lot of the traditional heart medication. And hey, don't just take my word for it. This is a direct insight from experts talking about these exact cases. When a patient isn't getting better, Ranolazine is singled out as the go-to second-line choice. It's what you turn to when the standard options have been exhausted. So what's its secret sauce? Well, instead of just slowing the whole heart down, Ranolazine is way more precise. It messes with something called the late sodium current in heart cells, which helps the muscle relax better. And get this, it does this without really affecting your heart rate or blood pressure, which is a huge plus. But here's the kicker. It specifically reduces resistance in those tiny microvessels we talked about. It fixes the problem exactly where it's happening. So what does this whole story about one patient, one condition, one specific drug tell us about the bigger picture? It tells us we have to start thinking beyond simple blockages. Get ready for this number, because it's pretty staggering. Over 70% of people in the same age range as our patient have high cholesterol, but less than 4% are actually getting treated for it. Think about that. It shows that the risk factors that can lead to complicated conditions like INOCA are just everywhere, and they're often completely overlooked. At the end of the day, the story of INOCA is more than just one diagnosis. It's about a massive shift in how we understand the heart. a move towards a much more detailed, personalized, and nuanced view of heart health. It proves that sometimes the biggest problems are the ones you can't easily see. But it also shows that with the right tools, we can find answers. It really makes you wonder, right? What other mysteries are hiding inside the heart, just waiting for us to solve them?